Hi everyone, my name is Dr.Mazhar and today I just start a series on ENT. So today is my first lecture on ENT. So to know about the ENT diseases like ear, nose and throat. So before knowing this, you must know the anatomy, what's the normal anatomy of these three systems, and after anatomy, then we will discuss their pathologies. So ENT mostly we study in fourth year, final year MBBS. So I hope so you will understand. So now let's start about the introductive PPT of that lecture. So see, in the ear, first of all, we start ear, then we start. I will talk about nose and throat in my next lecture. Today I just talk about the ear. Okay. So in the ear, as you can say that you can see in the picture, ear has three parts: external ear, middle ear, and internal ear. So external ear, as you can see in the picture, this is contain the external ear outside. So they contain cartilaginous part and bony part. So external ear is made up of cartilaginous part as well as bony part. And this is we call auricle, and this is the cartilage, and this is the cartilage, and some ears are present here, also some glands present here, and also ear present inside the ear, also some also wax is producing here. Okay, so this is the external ear, and this one is the middle ear. You can see in the middle ear, tympanic membrane is a part of external ear. Okay, the middle ear, you can see in the middle ear there are three bones like malleus, incus, and stapes. So these three bones are very smallest bone in the human body because they connect that these bones make a connection between external ear and inner ear. Middle ear is just a pathway, conducting pathway for sound. The sound travel from external ear canal, external orchestral meatus, tympanic membrane, and then through bones, and then travel through the inner ear. So you can say that it's a simply the pathway. So this pathway can help the sound waves to travel through these bones and then to the cochlea, vestibular, and vagus nerve. So this is how ear is located in our in our brain and in our temporal. This is the temporal part of skull. This is the temporal part. Okay. So middle ear is connected with brain to tegmentum. Tegmentum. This is the bony part that connect the middle ear to the brain, and this is the inner ear, and this is the eustachian tube. This eustachian tube make a connection between pharynx and tympanic tube. So this is also called tympanic cavity. So this eustachian tube make a connection between middle ear and nasopharynx. Okay. So outer ear. What's the outer ear? Outer ear is a consist of pinna and the external auditory canal. The pinna is a cartilaginous part. It acts as a funnel to capture the sound. So pinna is the cartilaginous part. As you can see in the picture, I show you in the picture. This is the auricle and this is a pinna. This because this make sound. This can capture the sound wave and they can travel through the middle ear. The pinna is a cartilaginous part and it acts as a funnel to capture the sound. Okay. The transmission of sound vibration through outer ear occurs chiefly through air. So what is mean that sound waves travel through air. So some air also present in the middle ear. Okay. Now you can see in the detail view that this one is the external ear, and this also they take the part in the middle ear. Okay, tympanic membrane they also part in the middle ear, and this is the pinna, and this is the helix. This is the lobule of ear. This is the helix, and this is the auricle pinna. This is the outer ear part. This is as you can see in the fatty deposition, and this is the external oculotus meatus outer part, and tympanic membrane and inner tube. So external ear have three parts. One is pinna and other one is the external auditory canal and tympanic membrane. So tympanic membrane is a part of external ear here. So parts of pinna, this is a this is a whole picture we call pinna. So these are the further parts of pinna. Okay, so you can appreciate in the picture. This is what we call helix. This is a prominent rim of auricle is called helix, and this is the we call antihelix. Another curved prominent parallel and in the front of helix is called antihelix. Okay, so this is we call antihelix. Then there is a concha. This is a concha. So concha describe a curve around a deep and the upper part campa concha and lower part what cavum concha. So this is the part you will see in the picture. And then there is a ear lobule. This is we call what ear lobule. And that this is we call antitragus. This is a tragus. This one is a tragus, and this one is the antitragus. And then there is a external ear. In external ear, this one is the auricle and auricle, or you can say that pinna. So this is the yellow elastic cartilage covered with skin. So this part is covered by skin, and except lobule. The lobule will not contain any cartilage. This part is made up of cartilaginous part, but this part is not made up of cartilaginous. Okay. So cartilage often source of graft material. Sometimes if we take some part of the cartilage just to, for example, sometime what happened, tympanic membrane rupture. So we have to just block that hole or some hole created, pathological hole created in the tympanic membrane. So sometimes we take some tissue from here and we connect the tympanic membrane just to close that hole. Then there is a no cartilaginous part between tragus and antitragus and the crus of helix. So this is a crus of helix and this is a tragus. So there is a no cartilage. So that area we call what incisor terminalis. This part. This is we call what incisor terminalis. What's the purpose? Just for the surgery of external ear canal or mastoid surgery. This is the purpose just to we go through this pathway and enter the middle ear. So this is just like a pathway for surgeon to go into where in the middle ear. Then what's the blood supply and lymphatic supply of pinna? So blood supply of pinna is that arterial supply of auricle like posterior auricle artery and superficial temporal artery. And then there's a lymphatic drainage, preauricular, postauricular, and upper deep cervical. Okay. And you can see in the picture how our ear take blood supply. Our ear take blood supply from external carotid artery. External carotid artery originates from where? Your aorta. So one branch go where in the internal maxillary artery, other branch go where mastoid branch. So this is how blood circulation framework created and gives supply to the ear. Now blood supply. This is also same thing we discussed previously. This is how that carotid artery supply the blood supply to where? To your ear. Then what's the external auditory canal? External auditory canal that I already discussed about. That one is the cartilaginous part and the other is bony part. So cartilaginous part make 1/3 part of what? Your external ear. And the cartilaginous is a continuous of pinna. Pinna itself is what? It's also made up of outer layer skin. So that skin continues inside the external ear. And this is a yellow elastic cartilage. And covering skin is thick and contains ceruminous and pilosebaceous gland that secrete wax. Here is confined air. That I already talked about in the first PPT that external ear canal is made. Canal is covered by skin. So skin has contained some glands like ceruminous and pilosebaceous gland. So that glands can secrete wax, and that area external ear part contain air. And what's the bony part? Bony part, just skin is thin, but is a two-third. This is how much? 8 millimeter, and this is 16 mm. So there is no ear and glands. So gland is only confined or present one-third part of the external ear, but inner two-third there is no gland. Okay, so this is an important thing. Then what's the difference between adult ear and child ear? Adult ear, you can see auditory canal, eardrum. Child ear, auditory canal, eardrum. Adult auditory canal little bit diameter increase as compared to child, because some structure in the children different than adult. Just you can say in the according to the shape and structure. So this is the how the pinna, how the child ear, adult ear is represented. Because in the children you stretch into in the more horizontal, but in the adult you stretch into more vertical. So there's some difference, just like the location. Structure is same, just like this direction. There the shape little bit different. And this one is the what? This one is the ear follicle, subiscular gland, seminous gland, cartilage. This is what? This is the outer one-third part of external ear canal. Then external auditory canal length is about 24 mm and not a straight tube. Okay. Outer part is a now outer part of the external ear is what? Of it goes up, back, and medially. Outer part, one-third part of the external auditory canal of the external ear is like that. And inner part it goes how? Go down, forward, and medial. If you want to see tympanic membrane of any patient in the ENT department, if you are working in the ENT department and you see any picture, any patient about the some external auditus meatus or auditus externa or auditus meatus externa infection, external ear infection. If you want to see tympanic membrane, so you do what? You pull the ear pinna upward and backward. Up first, make up the ear, and then it make it backward, and then lateralize. Then you can easily appreciate the tympanic membrane. So if any discharge, any hole, any pathology present in the eardrum, any perforation in the eardrum, so you can see easily through this procedure. So blood supply of external ear, external auditory canal, post auricular artery, and superficial temporal artery. And what's the nerve supply of external ear canal? Now I'm talking about the nerve supply. Nerve supply is like that the auriculotemporal nerve from mandibular branch of trigeminal nerve. So trigeminal nerve is the fifth cranial nerve. So trigeminal nerve give a branch. That branch we call mandibular branch, and that mandibular branch give blood supply to what? External auditory canal, and that provides sensory information from anterior wall and roof. And posterior wall and the floor sensibility is carried in the nerve fiber of auricular branch of vagus. That one is the eighth cranial nerve. We also call ulnar nerve. This provide what? Posterior and floor, posterior wall of external auditory canal. And tympanic plexus offers some also contribution. So some tympanic membrane, for example, your middle ear also gives some plexus to your external auditory canal. Now this is a lymphatic channels, how your nerve and gland. This is an innervation pathway for the ear. This is how the nerve supply of pinna, auriculotemporal, lesser occipital, greater auricular. This is how your ear contain nerves. Okay? And this is the distribution nerve supply, how your nerve supply take greater auricular nerve, lower one-third of lateral surface and lower two-third of medial surface, lesser occipital, upper one-third of medial surface. So this is how the nerve provide the innervation to the ear. Now talk about the tympanic membrane. This is the last part of external ear. Tympanic membrane is a thin, translucent, and is a boundary between external auditory canal and middle ear. And it's a oblique. It's not like a straight, not horizontal. It's little bit like that, like that. It's a oblique. So oblique sector is a post. How its location is a posterior and superior part more, its posterior and superior part more lateral than anterior inferior. Okay, so upper part of the tympanic membrane is what, it goes toward lateral, and the inferior part goes toward where, anterior. Then tympanic membrane have two parts, pars tensa and pars flaccida. I will talk about it. This is a tympanic membrane. You can see the picture. This is a tympanic membrane. Pars flaccida, this one, and this is a pars tensa. This is we call umbo, and this is the annulus fibrous. Okay, so this is how tympanic membrane is located. And tympanic membrane shape is what, oval, and it's placed oblique at the angle of 40 to 45 with the meatus. Meatus is the one with the bone attached with the tympanic membrane or eardrum. It faces downward, forward, and lateral. In adult, it faces downward and forward and little bit lateralized. But in children, it is almost horizontal. That's the reason in the children infection is more due to the horizontal position, and it's a purely gray shape. So you can see in the picture, this is the ear, okay, external ear, tympanic membrane, and this is how it is located. Now talk about the tympanic membrane parts. So tympanic membrane parts is like that. It's made up of two parts. That pars tensa that form most of the tympanic membrane, tightly stretched, and it is made up of outer epidermal, middle lamina propria, and inner mucosal layer. Inner mucosal layer is facing toward middle ear, and this is facing toward the external ear. And the annulus tympanus, peripheral thickened to form a fibrocartilaginous ring called annulus tympanus. And umbus and the umbo that already told you, umbo is a central part that tended toward inward toward the middle ear at the level of tip of Milius. So this is how the tympanic membrane is located. Now you can see in the picture. This is the structure. This is the structure and names of the different structure of eardrum. This is we call what, pars flaccida. This is we call posterior fold. This is the incus. This is the umbo. This is umbo. It is a, just you can say it's a tail of Milius. And this is a pars tensa. This is the, if you want to see the eardrum or you can see the Milius, so you can do the, you can pass the light and you see the cone of light. And this is a manubrium of Milius, and this is a annulus, and this is a short process of Milius. This is a short process of Milius, and this is a manubrium of Milius. This is a tail. Okay, so between the anterior fold and posterior fold, what is present? Pars flaccida.